Hello.
Hello, everyone.
How are
We
we all
are
today?
we are excited to be back and play Nurse Squad again with everybody. So, we have a new member right out of the gate. So,
Oh
Ashley,
my gosh.
welcome.
Ashley,
Thank
welcome
you
to
so much.
membership.
Totally. So, tonight, we are playing Peds. So, this is a pretty beefy game too. Pediatrics, there's a lot of material you definitely have to know. So, is anyone here who is like in peds, maybe has a peds exam coming up?
I am the biggest believer that for me, and I always qualify this for me because everybody's experience is different. For me, PEDS was the hardest course in the whole program because I felt like I was having to relearn everything I just learned in med-surg about adults, but everything's wrong. And now you got to learn it again and apply it to kiddos. And even everyone would always say, like, oh, but you have kids, that must be helpful. No, because my kids didn't match up with any of the milestones. None of the things made any sense. I was like, you kids are throwing me off.
Totally. Well, and it's pretty much like med-surg all over again,
Yeah.
except for, I mean, some of the same disorders, but a lot of new ones too, plus growth and development, plus like all these like principle stuff that you have to know.
Like vaccination schedules and stuff.
Yeah,
Oh my God. And
totally.
now, in my line of work, do you think I ever need to know that? No, because there's a chart. I can click on the button in the EHR and it'll show me what they're due for. So
Totally. I know. Well, and we had peds at my school, we had peds in the summer. So it was condensed into 10 weeks. And I was taking that at the same time as I think maternity and leadership or like a couple other classes. We lost a couple people from our cohort who
oh
failed
yeah.
that semester because it's definitely not something to underestimate. So we're
No.
excited to play this tonight. So especially for you guys having, so we have
Topher
one
is
person.
studying for peds literally right now. Bestie, I've got good news for you. This counts as studying for peds because we are going to test your knowledge of important stuff. And we talk about this all the time. If this is your first time joining us for Nurse Squad, this game is meant to test your knowledge of the information that you learn. So if you have our flashcards, if you have our peds flashcards, this is where you learn the information, you review with our combined YouTube playlist because we cover this together. So you learn the information, you watch our videos, you review the information, and then you play the Nurse Squad studying card game, and that shows you, number one, what are my weak areas? What am I struggling with? And number two, it shows you how your nursing professors might apply this information in the test-taking setting.
Totally. So how many people have played with us before? Queen Meris. Look at that. Queen Meris. My professor plays your maternity videos in every single lecture.
Oh my God.
Are they lecturing? Or are they just playing Meris's videos?
That is so funny.
That's amazing. That's amazing. Okay, Peds ATI tomorrow. Thanks for all you do. You got it. Yeah. And yeah, I'm wearing the wig today because my whole team was like, you need to wear the wig. And I do love the wig. I was kind of having a hair day, so wig is coming on.
Right before we went live, Cathy and I were sharing our hair woes with one another, and I think that the pink hair is the way to go. Like, I think that's the move. Like, you look great.
I love the pink hair. I do. So it looks like let's see, Topher, Ariana, you haven't played before. How many other people have played or not played? I'm just trying to gauge kind of our audience tonight because I'm going to kind of go through some of the basic rules and what's included in the game. And then we're going to divide up into two teams and play. So, they played the videos after she lectures, so the important info gets reinforced. Okay, that's cool. That's awesome. Okay, so I have never played. So there's definitely some people who have not played. This is Nurse Squad. We have 8 different Nurse Squad games. This is for peds, but we have farm, fundamentals, psychiatric, maternity, health assessment. Yeah, there they all are. Meris has got them all.
Ready? We got them. Plus,
So like,
Peds.
Oh, and there's the Peds for sure. So we have a game for all of the key subjects. So if you have our flashcards, that's a great way to learn the core information you need to know. And then our Nurse Squad game is a great way to test your knowledge. It's super fun. You can play with a small group. You can play with a large group. We play this live in every couple weeks or so. So the box, what comes in the box. So first of all, the box is like really nice. It's got like this magnetic close. And so I took everything out, but it's just like a one-piece box, super, good quality and hardy. And then inside the box, you have instructions for how to play. You have avatars, so you can choose who you want to play as if you want. You don't have to pick an avatar, but it's fun. So who are you playing your normal girl tonight?
So normally I play, if you've watched this before, you know that my girl is Willow the Wiz. She's got cool glasses. She has a hearing deficit like I do, and I love that. But I gotta say, I'm feeling some Rabia the Researcher vibes today. I'm feeling like Rabia. Look at her carrying that stack of literature. She's got that EBP on lock, you guys. That's who I want to be today.
I love it. I'm going to play as Carmen, of course, because she's got purple hair, which is kind of close to my pink hair. And she just kind of, when everything goes crazy, she knows who to call and what to do, even in chaos. So she's very chill. So I'm going to play as Carmen. Before we get more into like what's in this game, I did want to mention that we have a special promotion tonight for anybody watching. It's actually tonight and it goes through tomorrow night at midnight and then it's over. So if you're watching this video live, like, this live video recorded later, then you won't be able to use this code. But tonight and tomorrow, you can use the code NS20, which will give you 20% off any Nurse Squad game or the Nurse Squad like bundles, like the Fab 4 comes with 4 of the Nurse Squad games. And then we have the Great 8, which is all of the games. And this is also applicable towards any of our bundles that include Nurse Squad 2, right, Meris?
Yes, and those are called ultimate bundles. So if you are on the lookout, an ultimate bundle is going to be the flashcard deck combined with the Nurse Squad game that correlates. So for instance, you could get the ultimate Peds bundle, which is the Peds flashcards paired with the Peds Nurse Squad game. So you would be able to save this 20% on your order. So pretty great.
Totally. So NS20, definitely use it tonight or tomorrow. Okay.
Yes.
So in the box, continuing on, we have the how to play, we have our avatars, we have our hazard cards, which are unique to each of the games. And these are like real life nursing hazards that we kind of exaggerate on these cards a little bit. But you can play these cards against your opponent. So last time you may remember that, well, if you were here last time, I played a hazard card on Team Meris and they did not answer the question in the 60 seconds. Do you remember that, Meris?
My memory of that is a little foggy.
But
I'm not sure that happened.
I think y'all lost a hazard. We did lose the game in general though, which was crazy, but it was a really nice moment when Team Meris lost that hazard. So anyway.
Okay. All right.
So that's how we do here. We just talk smack. We like to do that. So there's 8 hazard cards. So I can play this against Team Meris. So we're going to break up this group into Team Cathy and Team Meris, and we can play a hazard card on each other to make the other team lose 4 points if they do not get the question correct. So
but if
that's what the hazard cards are about.
Correct, they get no points. So typically, for instance, here's a card on the top. This is a 1-point question. If we're just if we're just straight playing it, then if they answer it correctly, they get 1 point. If they answer it incorrectly, they don't lose any points. But a hazard means if you answer it correctly, you don't gain any points. But if you answer it incorrectly, you lose those 4 points. So you want to be strategic. Pay attention to your opponent's weak areas. And when you see that card popping up where you're like, oh, I know Cathy is weak in this, that's when you want to play that hazard card, right?
Totally. If you're playing competitively, and you totally don't have to play hazards. Like
No.
I was at a conference and there were students playing playing our psych game at our table, and they were looking to try to answer as many questions as possible and didn't bother with the hazard card. So you could totally do that too. There's lots of different ways you can play.
And there's something we haven't brought up very often in these lives, and that's that there are 2 questions on every card. So there's a top row question and a bottom row question. And this is a chunky deck, right? There's a lot going on in here because there's a lot going on in Peds. But not only do you have this many cards to go through, you really have double because we put 2 questions on. And the idea being that you would decide as a team or as a group playing, are we going to play the top or the bottom? They are different questions. There is no repeat question. So that way you get a different playthrough every time. And it's a really cool way to kind of extend that the learning that you will have in that. So you get a lot of questions. I think this one has like 200 some odd questions in it.
Oh, it's a lot. It's a lot.
Yeah.
And so questions are either 1, 2, or 3 points. 1 point questions tend to be easier. 3 point questions tend to be harder. So we shuffle the questions and then we pick them at random, just off the top of the stack. And I will ask Team Meris a question, and then Team Meris will ask Team Cathy a question. And the way we break up the group is if your handle, your username, starts with an A through an L, then you are Team Cathy. If your username starts with an M for Meris, or through Z, then you are Team Meris. So in the comments, tell us what team you are on.
Sound off. Because this happens every time. Every time someone comes in, guns blazing, answering a question for Team Cathy, and their name is like Zach. And I'm like, Zach, man, you're on my team. Don't do that.
Yeah, totally. Mate, to ace Peds, watch the videos, use the flashcards, play the game with your group. That is right. That is how you ace Peds. You will
sister.
Ace Peds that way. All right. So what team are you guys on? Team Cathy, don't be answering Team Meris questions. We gotta, there's a Team Meris.
Yep.
Team Meris.
Okay.
All right. Oh, Team Meris. I hope we've got some Team Cathy here.
All right.
Keely, you are not Team Meris. You are Team Cathy. Okay?
You're welcome to join Team Meris if you want.
D, E, F, G, H, I, J, K, L. Okay, Team Cathy. Okay, we got some Team Cathy too. I just want to make sure we didn't have like all Team Meris, or else that's kind of not gonna be a real fun game.
We say this every time. Don't Google the answers, you guys. Like, it's not like that's not the spirit of what we're doing here. It's not, nobody gets anything for winning or whatever. I mean, obviously we get bragging rights, but other than that, nobody gets anything for winning. So don't Google the answers. It takes the fun out of it. It's not that deep.
Challenge yourself. Also, we forgot to mention. I don't know. You go first. I was going to mention that we have a giveaway. Is that what you were going to mention?
No, that's not what I was going to mention. I love that though.
Okay. I'll say my thing first. So we are doing a giveaway towards the end of the game. We are going to give away a Nurse Squad game of your choice. So stay till the end to enter that giveaway. I still have to figure out some ridiculous thing to make everybody enter in the comments to enter that giveaway.
Now she doesn't tell me anymore. It's just a surprise, and it's my favorite thing every time because it's hysterical. Yeah, she does it just to make me die. Because I lose my mind every time.
Okay. All right. So what were you gonna say when I was talking about the giveaway?
I was going to say, before we start, one other thing that I wanted to mention is that these questions are written in like fill in the blank kind of format. We don't provide you with answer options, and that's on purpose. You are probably thinking, but NCLEX it's all, they give me the answers. Totally, they do. But if you can dig deep and pull that information out of your stored memory and say, oh, I know the answer to that, you're going to be able to apply it to the test taking environment.
Totally.
You having to dig deep and pull that information out for yourself is going to make your studying more effective.
Totally, because a lot of people are just used to taking the practice exams where it's like multiple choice. You're just used to seeing that multiple choice or select all that applies. But when you got to come up with the answer yourself, it just makes you learn it in a much more effective way. Like it just is going to really help your studying and help your game.
Right.
Okay. Who goes first tonight? I forgot.
I don't know. I think we went first last time. So okay. I should ask you first.
Yeah. Okay. Team Cathy, get ready. We only have 60 seconds. So.
Oh yeah. Where's my guy? Here's my guy.
Oh man, I shouldn't remind you about that. Yeah, there it is. I got mine too.
Oh God. Okay.
Okay.
All
right, Team Cathy, listen up.
Meaning your username starts between A and L. Anything in between. Team Cathy, answer this question.
All right.
Okay. Why is it contraindicated to perform backing up. This is a 1-point question from the principles section of the deck. I'm sorry. Why is it contraindicated to perform a blind finger sweep on a choking child? Why would we not do that?
Why would we not do a blind finger sweep? Why would that be a bad idea?
Tick-tock.
I know we got this.
Blind finger
All right,
sweep.
Team Cathy, why don't we do a blind finger sweep on someone choking?
There we go. Jessica got it.
Nice job, Jessica.
The answer on the card is it can lodge an item further into the airway. Yes, and that would be very bad because if you remember, our littles, they have different anatomy than we do, and their airways narrow as they go down. And the worst thing you could do is get that item lodged where it gets skinnier and skinnier because it gets harder and harder to get it out. You guys are so smart.
All right, good job. Lots of people answered it. Nice job, Team Cathy. Awesome. All right, Team Meris, you guys ready?
We're so ready.
1-point question.
Okay.
At what age should whole milk be introduced?
If you've watched my videos, I've talked about this. What age do we introduce whole milk? The key word here being whole milk, not any other kind of milk.
You probably talked about it in your maternity videos too, right?
I probably did. Yep.
Oh, there it is. Nice
1 year.
Yes. Nice job.
1 year. And this is just an interesting, in my opinion, interesting tidbit of information. The reason the littles need whole milk is because the fats are really important for healthy brain development. So they need the whole milk for the fats to develop their brain. And then when they're older, we've done that. So now we don't need that and we can go to skim.
Yep. Okay. Awesome.
Okay. Here we go. 2-point question from the cardiovascular system. Are you ready?
We're ready.
Oh, this is an interesting one. Okay. All right. Which cardiovascular disorder is diagnosed by hemoglobin electrophoresis?
Okay. So this would be a disorder that, can I give hints about?
Yeah, I mean, just
blood cells, right? The red blood cells are shaped a little differently.
Whoa.
Okay, was that too much of a hint? So this is how we would diagnose it. The hemoglobin's a little different than normal. Okay, there it is. I don't know. Did I give too good of a hint?
Yes, you did. But yes, you are correct. Sickle cell anemia is the answer.
Nice. Okay. Nice job, Team Cathy. Good job. Oh, TMI. Yeah. Too much information for sure.
Right?
Okay.
Thank you. Because Shannon is on Team Meris. She agrees.
All right, here we go. This is a 2-point principles question. What is the minimum age for a child to be considered eligible to begin receiving the seasonal influenza vaccination?
Ooh.
How old does a kiddo need to be?
This is a great question because I remember getting select all that apply questions that would include seasonal influenza, and you would need to know, is this child old enough to get that? So yes.
Oh, there it is.
So smart. So smart.
So fast on that one.
So smart. I love it.
Nice job. Nice job, guys.
All right. 3-point respiratory system question.
All right.
Yes. Oh, side note, also, yes, 6 months. And here's another like little tidbit that is going to come up on your nursing school exams. The first time a child gets the seasonal influenza vaccine, they need to get 2 of them. So they will get the injection and then they will come back, I think it's like a month later or something, and get the other one. The first time, there's 2 of them. Just got to know that. Okay. 3 points. Here we go.
We're ready.
Oh, okay. I'm gonna do the bottom question here just because it's like a name 2 ways kind of a question there's too many. So we're gonna do the more straightforward one.
Okay.
Following a tonsillectomy, patients should avoid what types of foods and liquids?
How many do we need?
Just I would say if you get either one of these, like I feel good about it.
Okay.
Following
So
a tonsillectomy.
Okay, after a tonsillectomy, what do we need to avoid? What does our child need to avoid? And then we could talk about why after you all nail this question, because I know you got it. All right. What are we not giving our kiddo who has sutures? Yep, we got them all.
Spicy red dyes. Yep, absolutely. Red foods and liquids because they can be confused for blood. And then hot and spicy because you just cut into their throat. We don't need to be putting hot and spicy stuff on an open wound. It's just
totally.
You know?
All right. Nice job, Team Cathy. Way to go.
Nailed it. You guys are so
all
good.
right. All right, you guys ready? This is a 2-point question in the principle section. In which stage of Piaget's theory of cognitive development is object permanence developed?
Oh boy. I don't know if I even know the answer to this.
Girl, I flushed all this stuff completely out of my brain.
I don't use this. I'm an ER nurse. I'm a trauma nurse. I'm not worried about Piaget.
No. So I have to say, you guys, nursing school is so brutal. They make you memorize some ridiculous stuff, I have to say. Yes, Shannon got it. Nice job. It's the sensory motor stage, birth to 2 years. So nice job, Shannon. So anyway,
I'm glad you guys know.
There's a lot of obviously very important stuff you learn in nursing school, and I don't know that this really qualifies because, like that was definitely purged from my head. I don't know. What else was purged from your head, Meris, when you left school? I'm trying to think.
Crutch gates. Gone. First of all, I don't know that I even want to say it was purged from my head because I just chose not to learn them. I decided that
I just took the L.
I said crutch gates are the thing that I don't get it. I'm never gonna get it, and I'm just gonna take the L because why not?
Right. Well, the ordering, and I never it just didn't matter how hard I tried. I never got that order like quite how they wanted it or whatever. So I'm like, you know what? Right. I'm gonna take the L. All right. We're ready for our next question.
Oh, me too, Shaquila. I hate crutch gate. It's terrible. And I'm like, and I never have to do that. I just show patients how to use one type of crutch gate. And it also, I don't have to drag and drop in order. I just show them, it's very difficult. So yes. All right. This is a 1-point nervous system question. Oh, this is a good one. Okay. All right. What is the term for decreased visual acuity in one eye, i.e., a lazy eye? What's the term? for decreased visual acuity in one eye?
All right.
Yeah, they just straight up
I was trying to
mouthing
like
the
think
answer.
through it in my head, and I think I was mouthing it. So,
Well, Cathy, you're correct.
okay. Sorry, I didn't say it out loud though, so I don't think anyone saw. Okay, decreased visual acuity in just one eye.
Not
No,
nystagmus. That's
that's
a good
like
guess.
That's like a rapid movement of the eye.
It's like a beating of the eye when you have the patient look over to the side and their eyes beat rhythmically. Myostigmus.
No, I think they were thinking myopia or whatever, which is like,
Jessica made it up.
Like, what is that? Oh, strabismus.
Nope, that's not it.
It's not it.
No. So, okay. So we're not getting this one correct. So the answer is amblyopia. Now, strabismus is misalignment of the eye, which may also be present. However, it's that very important keyword there, decreased visual acuity. So that would be amblyopia.
Okay.
Amblyopia.
I feel like I didn't give you all good clues because I didn't remember this one.
It's okay. I wouldn't have gotten it right either if I didn't have it in front of me. So,
okay. 1 point question from the respiratory system. What is pertussis more commonly known as?
oh, we know this. Pertussis. It's commonly known as something else due to the way it sounds. Aha, Trisha.
Nice.
Whooping cough. Whooping cough. It's called whooping cough because when they cough, they make this characteristic whooping noise. It's very, there's nothing like it. When you hear it, it is, you know what that is. It's just like,
it sounds like a whoop. It sounds like
a whoop. Yep. It's like, it's very weird. Yep.
All right. Nice job, Team Meris.
So smart.
Okay. How about a not random eye disorder situation question?
How about a 2-point gastrointestinal system question?
Okay, we got this. GI.
Oh, this is a good one too. And actually, this is a great one because I just saw a comment from a parent of a child who has this. They commented on my video or someone's video about this and gave some extra, like their experience with the signs and symptoms. I thought it was very good. Okay. An air enema is the diagnosis and treatment for which GI disorder? An air enema is diagnostic and treating which GI condition?
Okay. What pediatric GI disorder is diagnosed and treated with an air enema? This is important. This is likely something you get tested on. And can I describe the disorder? No, probably not. Can I? Yes.
Ah, there you go.
Nice. All right.
Yes.
Good
Intussusception. Intussusception is where part of the intestine telescopes into another part. I always think of it as like, you know, those like weird water toys we had as kids that are like, they're like a tube filled with water and you would just like it would just kind of keep rolling in on itself. That's what I think about with intussusception. Do you know what I'm talking about?
No. What are you talking about?
90s kids know what I'm talking about. They're like the little, like, they're like, there's one in my daughter's room and I'm like, I wish she's asleep right now. I'm like, I want to go get it.
Yeah,
It's like a tube, right? Like a cylinder, but it's hollow in the middle. And it's made out of like plastic, flexible plastic, and there's water inside of it. And so the whole thing is that you can kind of endlessly, like it just goes in on itself. Like you can kind of just constantly roll it down itself. Yes, Jessica, ADHD family right here. So that's why there's one in my daughter's room.
Okay, yes. People do know that toy. I'm like, what are you talking about?
Okay, good. I feel much better.
They also have sparkles in them. That's amazing. Yeah, and there's a we have a short, like a YouTube short on intussusception on our channel. If you want to check that out, definitely important to know that air enema question for sure.
Yes.
Okay, you guys ready? We have a 2-point normal growth and development question.
Okay.
At what age should the walking/stepping reflex disappear?
Oh God, my brain is buffering now. Walking/stepping. You know, this is also kind of one of
you
those
can
things.
explain what the reflex is.
Yes. Okay. So walking/stepping. If I hold an infant, right, and I hold them like, let's say, over a tabletop, and their little feet touch the tabletop, they will reflexively step forward. Now, they're not walking, right? They're just making a purposeful movement to keep themselves from falling. Somebody got it?
Someone got it. Fatu, it's 2 months. 2 months is when the stepping reflex disappears. That's the only that I remember, but that's fine.
I don't remember any of the reflex milestones, and we're being honest. I just said like 4 to 6 months for all of them because I was like kind of in the ballpark. That's something else that I don't from my memory.
Right. Okay. Oh, it's our turn to answer question. I also flushed reflexes out my out the window too.
Oh,
like,
yeah.
This is just feel bad for nursing. I feel bad for my former self, and I feel bad for you guys having to remember all this random stuff, like so much stuff. And that's why peds is so hard.
Likely never use unless you go into that specialty. Because again, I'm an adult ER nurse, right? I'm an ER nurse, and I treat children. Like, we certainly see, even though we have a children's hospital, we certainly see children. However, that's not my specialty. That's not my field of interest. And if I needed to know that information, I would just look it up because I'm a practicing nurse who's not taking the NCLEX. So,
right. I know. It's just in nursing school, you have to know, the universe of nursing. You just know the absolute universe. And then when you get out, you just can kind of specialize.
Exactly.
Oh, right, Sierra, you are team Cathy. You are team Cathy. Yes. And you always know that because you start with a C. Anybody who has a name that starts A through L, I can sing the alphabet again too if you need it. So Sierra team
And if
Cathy.
you are M through Z, you're on Team Meris.
Okay. Yeah. No, we should. This is a good reminder because I know people join partway in.
Yes.
And so for people just joining us, we're playing Nurse Squad. We're playing Peds. If you're A through L, you're Team Cathy. If you're M through Z, you're Team Meris. And Team Cathy is getting ready to answer a question right now.
All right, Team Cathy. We got a 2-point musculoskeletal question. Oh. This is another one that I would not know the answer to if I were not looking at it right now. How does the affected leg in Legg-Calvé-Perthes disease differ from the patient's other leg? So let me read it to you again, and then I'll start the clock. How does the affected leg in Legg-Calvé-Perthes disease differ from the patient's other leg?
How does it differ in appearance from the other leg?
That is not what I said.
How does it differ?
Yeah.
Okay. How will this leg look?
It could be I'm painful. It could be. There's lots of things.
Okay.
There we go.
Yeah.
CD got it. Yes. It is shorter. It is shorter. I'm glad you got that because I certainly was not going to get that.
Yep. The affected leg is uneven to the other leg. All right. Yes. I have a 2-point principles question for Team Meris. Which parenting style is considered to be ideal?
If you have watched my video on this, I told you a trick to remember which one is considered to be ideal. So this is one that is going to have some flexibility in it, but still have like rules, you know. It's high warmth, but it's also got a lot of structure.
Oh, there it is.
Authoritative. Yes, absolutely. Authoritative. And I told you in my video that the way that I remember this one is that it's authoritative is give and take. It is a healthy relationship of give and take that respects boundaries and rules, but also provides for warmth and love. Yes.
Nice.
Absolutely. You guys got it.
Nice. Now I need to ask you all questions. Sorry. I'm here. Okay. 3 points, normal growth and development. Oh, wait. Ooh. Did you all just answer this, or was I?
No.
No, yes. You need to ask me a question now. You need to ask Team Cathy, because this is my authoritative.
Yeah, you asked us that.
Okay. Yeah, I asked you guys the authoritative. And so now we get to answer a question, but instead of answering a question, we can play a hazard card on you, correct?
You can play a hazard card on us.
Okay. All right. So the hazard
Everyone
card,
in the comments is like, y'all get it together.
I know. It's your turn. I know CD's like, come on. We might need to appoint someone to like keep us together. The problem is that we go on these little tangents to explain things or whatnot, and then like, whose turn is it again? Oh okay, God. So we're gonna play a hazard card on Team Meris. It is the anxious caregiver card. It says, Jimmy's caregivers are pretty anxious about his treatment plan. One of your most important jobs is to talk with patients and their families to help ease their nerves. It takes time, but it's worth the extra effort. So you guys have to answer this question or else you lose 4 points, Team Meris.
Okay.
All right. You guys ready?
Yep.
What integumentary finding should be documented to avoid future suspicion of abuse?
Yes. And I'm not going to say that yet. I'll say that at the end. Yes. This particular congenital integumentary finding needs to be documented because it's present from birth, and it could look to somebody who does not know that this exists, it could look like bruising from, yes, there we go.
Okay, but what do we call it now? No, I know that's what you probably learned.
Listen, she said new name, but I forgot. Yes, it is congenital dermal melanocytosis. So Mongolian spots is not an appropriate name. And that is what is, and we have it on there because that's what you're being taught and what is showing up on your test. Right. But it's important for you as culturally competent care providers and people who are aware of being inclusive and being advocates for using the correct language, that the correct term to use for this condition is congenital dermal melanocytosis. Is it a mouthful? Yes. But is it worth it to not be offensive? Also, yes.
There's another word. So someone just educated me on YouTube. I think it's slate gray nevus.
Oh,
slate gray nevus. I'm pretty sure. Let me look it up.
We're gonna look that up. See if we can.
I think that's another word, and that's a little shorter. So for people who are like, this is too long. Nevus. Yep, that is another one. Slate gray nevus. So if you do not want to say congenital, you don't want to say that whole mouthful, slate gray nevus is another appropriate term for to replace with to replace Mongolian spots, which we don't want to say. Okay.
Absolutely.
So
yes, I'll put it here in the Here we go.
Totally. Okay. So now I ask you guys, because we just forgoed our turn, guys, Team Cathy, to try to trick Team Meris up, which didn't work. So now they get to go again. So, all right, Team Meris, you guys ready?
Ready.
What ear disorder is more commonly known as swimmer's ear?
Oh boy. All right. This one I know because I have a lot of experience with swimmer's ear. Swimmer's ear affects
what is the fancy name for swimmer's ear?
And you'll know the answer based on it's describing which part of the ear is being affected. It is not otitis media.
That would be a middle ear infection.
That would what we think of when we talk about an ear infection typically. I got, yes,
There it is.
otitis externa. Yes, I got otitis externa. I got swimmer's ear from being a work from home employee who wore AirPods in my ear
Oh yeah, no,
because
that's a
we
risk
would be in
factor.
meetings for forever and forever and forever. And then I would be like, why are my ears so itchy? Turns out, gave myself swimmer's ear from not letting my ears be exposed to the air and dry off. And that's why now I have the over ear one.
Over the ear.
And the only reason that I'm wearing these is because my hair looked really cute today and I didn't want to mess it up. So
so fun fact about my ears is somehow like me and my daughter, we have this excess production of earwax with cerumen. And so my headphones get super gross. So that's how nobody steals my my AirPods, because they open them up and they're like, oh nope. They put them back because they're super nasty. I do clean them, but anyway. And my daughter Sarah gets it too. So like I think it must just run in the family or whatever. So
oh yeah. Guys, do you think that we should play a hazard card? Because I think we should play a hazard card on Team Cathy.
Yeah, we got this. Play that hazard card. We're not scared. We're not scared of you.
Okay, great. Thank you, Shannon. Okay, this one is my favorite, and I designed this hazard card specifically based on my daughter because this is her to a T. Can I get a sticker? And as you can see here, she's surrounded by stickers, and she's looking at this sticker with a jeweler's loop, like where they look like to examine diamonds and stuff. And it says, kids love stickers. They also love to take their sweet time picking one out. Guess your next patient is going to have to wait until your slow sticker picker makes her choice.
I love that. It's super cute. Super cute.
Super cute. Okay. 3-point endocrine system question.
All right.
We'll see. This. All right. Growth hormone replacement should be discontinued once what has occurred?
Okay.
Growth hormone therapy should be discontinued after what point?
Okay. So we've got somebody with growth hormone deficit. They're receiving growth hormone therapy, and we should discontinue the administration of growth hormones when what happens? Super important. It's like bold and red on our flashcard for sure. Yeah.
Wait, but what happens?
Okay. So Ariana.
Okay. Wait. There we go.
Okay.
Combined.
If you combine multiple comments, yes. We're there.
So epiphyseal fusion is what we said. Closure of the epiphyseal growth plate, closure of the growth plates, whatever you want to say. Yes, because we don't want to be stimulating their body to grow when the growth plate is closed.
Yep.
We don't want that.
That's an important one. You will likely get asked that for sure.
Yes. So good job. 0 points because it was a hazard, but great job. I'm very impressed with you.
Right. And we get to answer another one now.
3-point musculoskeletal question.
Okay.
All right. For a child using a Pavlik harness, how should the nurse educate the caregivers to adjust the straps?
Oh, this is a trick question. But okay.
Say that.
Okay. So, all right. When we're providing teaching on a Pavlik harness, what are we going to tell our parents about or caregivers about adjusting the straps? What are we going to say about adjusting straps? Y'all got to know this. This is super important. What do we need to say? Do not do it. Yes.
Yes. So caregivers should never adjust the harness, but instead follow up every 1 to 2 weeks with provider for adjustment. I thought about it as braces on my teeth, right? I thought about I can't adjust the braces on my teeth, and in fact, it would be bad for me to do so, right? I would screw up what's being done. So yes, exactly.
Totally. Good job. Good job, Team Cathy. guys rock. Okay. So we'll take a break here to let people enter our giveaway. And then when we come back, just so you and I remember, Meris, I'm going to ask you guys a question. Okay.
Okay.
So I'm going to have that card like ready to go here so that I don't like rip, don't.
I know.
not
Cathy
remember.
gave it away. She was like, that's a trick question. I was like,
was that giving it away? I don't know. All right. Okay, we're doing our giveaway. So we're giving away a Nurse Squad game of your choice. If you want to enter this giveaway, then you need to put what I'm going to tell you in the comments, and you only can enter like once. So do not enter more than once, or else Angelina, who's going to pick the winner at random, she will disqualify you. She will disqualify you in a second if you enter more than once. So you only enter once, all right? If you enter more than once, you're going to get disqualified, so don't do that, okay? So if you want to win a Nurse Squad game, you're going to put in the comments, gimme, Gimme, so we're using slang here, gimme some Nurse Squad, okay? Gimme some Nurse Squad, put it in the comments, and then you will be entered to win a Nurse Squad. So, okay, and then if you just joined us, we are divided into two teams, okay? Team Cathy is everybody whose username is A through L, and Team Meris is everybody who has a username of M through Z. So somebody, okay, good. You guys are using the proper slang here. Give me some Nurse Squad. That's perfect. And so, yeah. So anyone who just entered, if your username starts from A through L, you are with me. You are Team Cathy. And if you just joined and your username is M through Z, you are Team Meris. And should we see while people are entering, should we like count up points? You want to do that? Sure. Okay. And so 5, 6, 8, 10, 11.
13.
Okay. So all right.
Y'all. Listen, there's a trophy on the line.
You pull out the trophy, man. I do not have a trophy.
Tell Bill to buy you a gosh darn Nurse Squad.
I need a trophy. Like, I don't even.
Angelina says she's about to close. So if you haven't entered already, if you have, don't you dare type it again. But if you haven't entered already, give me some Nurse Squad if you want to win a Nurse Squad game of your own.
Totally. All right. Ooh, this is a good question.
Okay.
Is it okay? This is your first time participating. Hi. All right. Well, welcome. We do this like on the regular, and it's a lot of fun. You guys will learn a lot of stuff for your test, and you can learn how to play Nurse Squad. And
speaking about on the regular, should we tell them?
Yeah.
Okay. Real quick, get your last entries in. So we used to do this once a month, right? It's super fun, and we love to do it. We're going to do it 2 weeks from now, and we're going to see how you guys like doing that, because you seem to really love playing Nurse Squad with us. We love playing it with you. It's super fun. So we're going to do this again March 22nd. It's a Wednesday, March 22nd, same time, 5 p.m. Pacific, 8 p.m. Eastern. It'll be right here. We're going to do it again. Did we pick what we're doing? Are we doing?
I think we're doing nutrition because that's our last game that we haven't played. And
yes.
And so you guys know, you guys may know already, is that you will be asked nutrition questions in so many of your classes, not just nutrition, but in med-surg, in funds, maternity, like all the classes. And
all
peds, like, yeah. So nutrition is super important in nursing school, like which vitamins, what, are rich in what, so like what foods have which kind of vitamins, what you need to teach your patient, all that stuff. So about the entire game series. Oh, that's awesome. Okay, well, you can enter too. Okay, so if you have all the games, then our customer service team will work with you on that. So go ahead and enter too. even if you have all the games. Okay.
Clarissa, this is exactly how I felt about nutrition as well. And that is 100% why Cathy is doing the videos for nutrition and Meris is not. I was like, Cathy, put me out of my misery. I cannot.
So I totally dig nutrition. We got a nutrition cram course that's coming out soon too on our membership. So that'll be good. It's like 1 hour long. All the nutrition stuff you need really quickly.
I'm sorry. I have to interrupt you briefly because Angelina just sent me basically a ransom for the Nurse Squad card game. And she said, and I quote, wait for it. She said, like this video or no winner.
So, okay. So everybody liked the video or Angelina's not
I just
picking
got
a winner,
a ransom note.
You did get a ransom note. I totally didn't see that. Meris is better at the multitasking thing, so
it's the ADHD, besties. Don't worry.
Okay, all right.
So, like this video, give it the likes. Let me ask her: is there a certain number? How many do we need?
Yeah, hit that like button, guys, so we can give away this Nurse Squad for sure.
Yeah.
And while you guys are doing that, and she's picking the winner, because I know everybody's going to do it. I'm going to ask question. What? We have made 2 more questions. Do time for 2?
Yeah,
who started?
So. Two rounds?
Maybe. Yeah.
Okay.
Who started? Right. Did I ask you first?
We asked you first.
Okay. So
this one and then you and me again.
Okay. Got it. Okay. You ready? Team Meris, you have a 2-point respiratory system question.
Okay.
What respiratory disorder is characterized by a hoarse or muffled voice, drooling, and dysphagia? Super important.
Super important. Interesting. We don't see this very commonly anymore. We used to see this condition very frequently. And then something happened in the greater public health sphere that decreased the incidence of the condition that causes this. Not croup. You're on the right track, but the drooling is the number one thing and the muffled voice, because if I can't swallow, why can't I swallow?
Right.
I'm drooling.
Yeah, you can. And you would never, well, we'll talk about some teaching after. We'll talk about some, oh man, I forgot to turn the thing over. Oh, no.
Nope, not seizure or whooping cough. This is a respiratory condition.
I let you down. I turned the
epiglottitis.
Oh, they got it. Okay.
Yes,
that happened within the recovery.
So epiglottitis is typically caused by something called Haemophilus influenzae type B, and you get an injection for it. It's the HIB injection of the vaccination series. So now, thanks to public health efforts for childhood vaccination, we almost never see epiglottitis anymore. I've never seen it in my career. I hope I never do it, and that includes my pre-hospital career. This is terrifying because Cathy, what were you about to say?
Yeah, so there's some definite things you do not do, right? If you suspect that someone has this disorder, you would never put a tongue blade or anything else in their mouth, because you may lose that airway. You may cause that airway to close. So that's going to be a really important thing.
If we accidentally touch that inflamed, swollen epiglottitis, it will slam shut over the airway. And now you are out of luck, because how am I going to get past the epiglottis to intubate that child, right? So the next thing that I want you to know about epiglottitis is that your priority action, other than don't put anything in the mouth, is prepare for intubation, okay?
Yeah.
This is a child who cannot protect their own airway, so we need to protect it for them. No throat cultures. Yes.
Oh, everybody's on it. That's great.
Yes.
That's totally the thing you're going to get asked about epiglottitis. So
really, and keep them calm too. That's another one. Keep them calm and reassure them, because if they get uppity and they start
wound up and
and
crying and freaking out, it's not good.
Not good.
It's not good.
All right. Ready?
Yep.
2-point question from the immune system. The nurse should educate a parent that their child with chickenpox is no longer contagious when what occurs? How do we know you're not contagious anymore with chickenpox?
Chickenpox. Right. what happens and when we know our kid is no longer contagious, can go off and play with peeps. Yes, when it crusts over.
When
the
it crusts
lesions
over.
crust over.
When all lesions have crusted over. So if we
Yep.
have some crusted over, you're still contagious. Yep, absolutely.
Right. Nice job.
You guys are so smart.
This is the last question, isn't it?
Last question. Yep.
Okay. Oh, this is a pretty easy one, actually. 2 points. Normal growth and development. You guys have done really well. So this should be
we need 2 more likes on this video. Angelina says she wants to get to 50. We have 48. I don't know why I was going to show you 48 with my hands. Anyway, we have 48. It's been a day, you guys.
4, I'll do the 8. Okay. So,
I think you're witnessing like real-time mental breakdowns from Cathy and Meris.
I think so. Okay. You guys ready? Last question. An infant's weight should triple by what age? This is so highly tested on.
Highly tested on.
Oh yeah.
Highly tested.
That's the best part about Nurse Squad. We just like give all the really juicy stuff that you are totally going to get tested on. Yep, there it is. 12 months. Yes. Nice job.
An infant's weight should double by 6 months and triple by 1 year of age from their birth weight. Yes, 100%. You guys,
you guys did so good.
I know. You guys really killed it this time.
Okay. Do we have a winner?
Do we have 50 likes?
I don't know. Where do I see the likes? How do I
We can't. That's the issue because we're in like a streaming software. So
okay.
I'm just gonna
Angelina, do we have 50 likes? Can we announce our winner? Okay, yes.
Oh, yay. Okay, yes.
Okay.
All right.
Awesome. All right. So our winner of a Nurse Squad is Karen Fernandez Soto. Karen Fernandez Soto. You are the winner of a Nurse Squad game of your choice, and you just need to email support@leveluprn.com. And
I put it there in the comments for you so that you can just copy and paste it if you need to. Let them know, they know to look for you, but let them know which game you want and everything like that, and we will get it to you. And like Cathy said, if you have every single Nurse Squad game that we have already, let them know that, and we will make sure to get you something else.
Yep, we'll take care of you. Okay.
Don't forget.
Yeah.
Don't forget about this. If you had fun playing this and you want to play this with your friends, by the way, half the reason that we made this is because Cathy and I talked all the time about how we love study groups, but it was really hard to keep people on track. It just kind of turns into a venting session, a talking with your friends session, which is good and important, but this lets you have fun with your friends and stay on track and study. So, yay.
Yeah, totally. And don't forget, 20% off Nurse Squad products tonight and tomorrow, only through midnight tomorrow night. So definitely get on there. Use the code NS20. 20%
is a lot too. Like I think last time we did 10%. So like we like take advantage of this. I'm super glad that you guys are loving it. And yes, don't forget the next one we are doing is going to be Wednesday, March 22nd. Put it on your calendar. I love this that said that I'm putting it on my calendar. It's fantastic.
I love it.
Yes. So put it on your calendar so that you remember that we are playing Nurse Squad again, March 22nd, 5 p.m. Pacific, 8 p.m. Eastern. It'll be the same idea, but this time we're doing nutrition. And whether you are in nutrition now, whether you are in any other class, or whether you are just looking to go to nursing school, nutrition is a gotta know it subject. So show up, listen, participate. I promise you this information will be on your NCLEX.
Totally. Okay. And all right, thank you. Had fun here.
You're taking your boards on Monday. Friday. Oh my God.
And then C-Day, you've got the package. You have the comprehensive nursing package. I hope you love. So that has all our flashcards, has all our Nurse Squad games, has our dose calc book, tip of the day, like all the stuff. So
I just bought a complete pack. Oh, I hope you love it. Oh my gosh, I hope you love it.
Awesome.
Yes. Oh, yes. The code is NS20. NS20. And if you, I'm not sure if I'm out of pocket with this, but if you are a site member, a Level Up
Yes.
RN website member, if you log into your membership, you already get a discount on our
And this
products.
is stacked on.
And
It's
this
stacked on.
stacks. So if
Mhm.
you have our Level Up RN site membership, where you have the core content videos, the cram courses, the NCLEX questions, the contact hours, all of that stuff, log into that first and then add the products to your cart. You will get money off anyway, and then you can use NS20 to save an extra 20%.
Totally. So Kylie just passed their comp predictor thanks to our videos.
Yay! That's amazing.
Congratulations.
Congratulations. Oh my gosh, I'm so proud of you.
That's awesome. Oh, and then CD said that their hubby has decided to go to nursing school. So yeah, no, that's a great thing.
Oh my gosh,
That's
and
awesome.
then they'll have you to help you,
Oh yeah.
like, oh my god,
Huge.
yeah, he's gonna be great.
Totally. Totally. All right, guys. It was so fun tonight. You guys are really sweet. I'm glad you guys enjoyed it. Hope you can join us in a couple weeks when we play nutrition, and just appreciate so much all the love and support. You guys are awesome. So yeah, we'll see you in 2 weeks.
Yeah, have a great one. Keep pushing, keep studying.
All
We're proud of
right.
you.
Bye.
Bye.